Brenda, owner of Zackel & Associates Legal Nurse Consultants. Today, you will learn about the updated guideline regarding electrosurgical safety. The greatest risk associated with electrosurgery are patient burns. So, what is electrosurgery? In electrosurgery, there are two energy delivery modalities, monopolar and bipolar. In monopolar electrosurgery, the current travels from the active electrode to the dispersive electrode placed on the patient. In this case, the active electrode is the Bovie pencil the provider uses to cut or coagulate into tissue at the surgical site, and the dispersive electrode is the grounding pad that we place on the patient. In bipolar electrosurgery, a grounding pad is not needed because the current only travels through the tissues between the tips of the bipolar forceps. The electrosurgical unit, or ESU, is the device that the electrodes are plugged into to incise tissue or control bleeding by causing the coagulation of blood. The electrode cords should be placed perpendicular to other cords or as far from each other as possible. If a medical device such as this one is suspected to have contributed to patient death, it must be reported to the FDA and the device manufacturer. For patients undergoing electrosurgery, any metal jewelry that will be between the active and dispersive electrodes should be removed. If this is impossible, the surgeon should be notified, the use of other technologies should be considered, patients should be educated about possible adverse events, and all jewelry sites should be evaluated postoperatively for burns. Patient education provided and jewelry site evaluations that were performed should also be documented. When a patient has an implanted electronic device, or IED, the anesthesia and peri-op nurse should discuss with the team managing the IED before surgery to describe interventions needed to safely manage the device in surgery and after. In an emergency when the team managing the IED is not available, the anesthesiologist and nurse should consult the IED manufacturer via a 24-hour hotline to determine the appropriate interventions. If your client suffered a burn injury as a result of negligence during surgery, our determined team at Zackel & Associates are available to investigate the relevant information your client needs to strengthen their case. This is Brenda Zackel, bridging the connection between medicine and law.